Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right and the upper right wisdoms for evaluation. Now, this is the panoramic view. On the panoramic view, you can very clearly see that the lower right wisdom tooth is horizontally impacted is associated with the nerve, and the upper right wisdom tooth is over erupted. Now, you can see a slight radiolucency around it. Now we're going to take you to the transaxial view of the upper first, and then we'll take you to the transaxial view of the lower. Now this is the upper right wisdom tooth. The upper right wisdom tooth, you can see, does not have fused roots. And those fused roots you can very clearly see. There is a slight curve in the upper as well, and it's very closely associated with the palatal palatal cortical plate. My apologies, and hence there's a very great risk for fracture of the palatal cortical plate, and something that should be kept in mind when extracting the upper right wisdom tooth. We don't see any major periapical radiolucency other than with the distal. Here you can see a slight radiolucency, and could also be the reason for the slight sinusitis we see here. Now moving to the lower right wisdom tooth. Now this is the lower right wisdom tooth. You're moving distally, and you can see that so far the nerve is away from the crown and the mid root portion. Now as we are moving, this is where the roots differentiate. This is the mesial root, this is the distal root, and you can see as we're moving towards the ramus, the nerve comes in very close association, and here you can see that still have a distance between the nerve and the tooth. So the nerve is not in contact with the roots. They're not compressed by the roots, and hence extraction of this tooth will not have any effect on the nerve on the lower right hand side. So here you can see again the nerve is placed buccally, whereas the tooth is placed lingually. So here we can show you that the nerve is placed on the buccal aspect, and the tooth is placed on the lingual aspect of this lower right side. So this is the crown structure, and from the crown structure, as we move towards the root apex, you will be able to see that the root apex comes close but does not come in contact with the lower right wisdom tooth, and hence there is no risk for nerve damage as a consequence of extraction of this tooth. If there are any further questions, we would be extremely happy to help. This is the axial view of the upper. This is the right hand side right here, and this is the axial view of the lower. And here you can see that the tooth is comfortably positioned lingual to the nerve, which is right here. Thank you very much.